mic. Okay, can you hear me okay? Okay, I'll make sure to stand here for that. So thank you for coming today. We're going to do a brief overview of residential care facilities, assisted living, and skilled nursing, and we'll leave a little time at the end for some questions and answers for you, okay? So I wanted to go over the continuum of care to kind of give you an idea of where things fit into place. So what we'll be talking about today is I'll be talking a little more about skilled nursing facilities, and Crissy here will talk about assisted living in more detail. But it's just to show you the continuum when you go from being independent in your own home, and then as you need further assistance, how you move up the levels to assisted living, and then as you need further assistance, how you would go into skilled nursing facilities is what it shows. And what the overarching piece is that regardless of what setting you're in, there are services you can still receive, regardless if you're independent, in assisted or skilled. Hospice can come into any of those settings and provide assistance, as well as dementia care can be provided in all of those settings in various ways. So here's a really quick snapshot of the two, and then we'll go into those in further detail. So residential care facilities, you might hear there are different kinds. So there's assisted living and boarding care. They're all licensed under the same umbrella, but when you think of assisted living, it tends to be those larger communities. You may even see some of their TV commercials on. And then there's a smaller where they're kind of like mom and pop, little 6-bed homes where people are taking care of others. These are licensed facilities, but they're non-medical care. And that's what we really want to emphasize there. They're meant to provide people with some activities of daily living assistance, like meal preparation, some medication management, but they're not medical facilities. So they're not required to have nurses on staff. The caregivers there are not required to have specific caregiver licenses and training. And that's the big difference between skilled nursing facilities, where it is medical. It's a medical setting. There is a registered nurse on the staff there 24 hours a day, and they're able to provide further assistance for those who may need, full assistance with their bathing, someone to administer all their medications, help someone recover from a surgery, and get some physical therapy and occupational therapy. Oh, and aside from the staff being required to have a license, there's specific staffing ratios that are required by the State Department of Public Health. They're the ones who license those facilities, and they're required to have a certain amount of staff for every resident in the home, and that does not apply to residential care facilities for the elderly. So, and I'm going to turn it over to Crissy to talk a little further about residential care.
Okay, so one of the most important things is how would you choose an assisted living? So this is what we like to share with consumers, that before you go out shopping, first you need to figure out your support needs, both short-term and long-term care needs. So while you can't predict the trajectory of what a condition will have or your dependency level, how fast you'll become more dependent, when you're looking at a facility, you want to think about how are they able to care for me or my family member now, and as they become more dependent, what is their training? Can they handle increased medications? How can they provide for hospice care? Are they familiar with that? So you want to get a good idea of what the support needs are. Then you want to consider financing. So assisted living is private pay. Some long-term care insurance will cover it. There are very few SSI beds. Veterans can use some aid and attendance to pay for care, but it's pretty much private pay at this point. So that's the second component. And then after you know your needs, you know what you can afford, then you go start shopping for assisted living facilities. And you look at, most people choose to look in their geographic area using zip codes. And it's important to know that a change in condition should prompt a discussion. So a lot of people move into assisted living thinking they can age in place and stay there. Oftentimes that is not the case. Conditions will change, and it's important that you know that that could prompt a move, but it should definitely incite a discussion, and communication is very important between the resident's family, and the facility in navigating that change. So when you're looking, the resources that are out there that can help you, there's placement agencies. This is a service that is free to you, the consumer. They will help you find facilities in your area. It's important for consumers to know, and they oftentimes don't know, that the way placement agencies work and the reason it's a free service is that they hold contracts with facilities. So once a placement agency makes a placement, the facility will pay them. And so when you're using a placement agency, it's important to ask them, are you showing me all of the facilities that are right for me, or are you only showing me the facilities that you have a contract with? So it's important for you, the consumer, to do your homework, to know what other facilities are in your area, all of them, and if you think one might be right for you, that you ask to see that one. The second thing is marketing tours. You can go to a facility and go on their marketing tour. Please note that this is a marketing tour, so they're showing you things that they want to show you. It's important to dig a little deeper. After you've done your homework and you know your support needs and you know what you can afford, you can ask critical questions that are important to you or for the care of yourself or the resident. And you can ask more than what they'd be showing just on a marketing tour. There's also guides and directories that will list facilities in an area. This is one of them that I'm sure many of you have seen. This one's pretty comprehensive. There are other ones like Lifestyles and other ones you can pick up in CVS or other grocery stores. And those are, will list facilities that choose to participate or advertise in those magazines. You can also hire a geriatric care manager. It's a little different than a placement agency. These are individuals who kind of care for the person and watch their care and the transitions in and out of hospitals. They're exactly that. They're managing someone's care. So what you can do for yourself is on the other side. We recommend visiting the facility at random times, not just during the tour, asking to dine there at random times again, kind of unscheduled, so that you can get a feel for the atmosphere and how the caregivers interact with the residents. Reviewing the public records is obviously, that is what CARR is about, and so we strongly suggest that families look at the public record, the compliance histories before they tour, so they can see maybe where the gaps are, and if that's something that's, medication is something that we always use. If a resident's going to be on a lot of medications, you want to make sure that you're not choosing a facility that's had a lot of citations with medication management. So the places you can look at the public record is at the state office. The facility should have their most recent inspection available to you, and also on our website we host the compliance histories. One last thing that we want to empower you to do when you are shopping is to ask real questions, to go prepared knowing what you need, and expect that you get real answers. I wouldn't just stop at the marketing tour. I would ask to meet with the administrator, to view them as the head of the household, and to make sure that you will have rapport and communication there, that they're proactive versus reactive. So I'll turn it back over to you.
Okay, so Crissy went over what to look for in residential care. Some of the points are pretty similar, but when you look at skilled nursing, you're looking at a medical setting. So you really want to evaluate the nursing care and want to know what doctors go in there, what type of doctors from what type of insurance go into these facilities. So placement agencies, Crissy talked, the good and bad with placement agencies. Typically, they don't help with skilled nursing facility placement. But my suggestion is, if at any point you had used a placement agency and were happy with them when looking for assisted living, if you call back that agency and remind them you worked with them in the past, and now you're looking to move your loved one to another level of care, most of them will still help. So it's a good practice for them. Guides and directories were talked about. The new Lifestyles booklet has a list of skilled nursing facilities in the county and other resources, as well as the San Diego Elder Care Directory. I want to call it the UT book, but it's the San Diego Elder Care Directory. Yes. And then I have Cal Quality Care up there and CARR. They're both two different websites. One that I forgot to put up there was the Center for Medicaid Services. So Medicaid Services, they're the ones who say, yes, you're allowed to be a skilled nursing facility. They have the group from Department of Public Health that goes out and does the annual inspection at the skilled nursing facilities. On their website, they have a 5-star rating system, similar to what's used to rate hotels, is how they rate their skilled nursing facilities. So you can actually go on that website and look at any facility throughout the country. So if you're looking for a loved one who may not even live in the area, you can still access this information, and you can see where they rate compared to others, what kind of deficiencies they may have had and where they rate. They actually go over on there how they determine the rating. It's very complicated. I read it the other day, but it does give you an idea that they're looking at many factors when determining that rating system. And then Cal Quality Care also has a little more information on it. It talks about some of the other services that are offered. Some nursing facilities can offer transportation to medical appointments. They have a van to do transport. Some don't. There's these other ancillary services that some places have versus others that it'll list some of that information as well. Now, CARR is the California Advocates for Nursing Home Reform. And on their website, we have a table out in the exhibition booth. We have some printouts from their website, but it's a good place for consumer fact sheets. So when someone calls our office and they're looking for advice, what to look for, they're trying to find a place, we always direct them there as one resource to get a checklist and say, okay, when you're walking around, look at these things. Ask questions about these pieces when you're visiting the facility. And they have some handouts on how does Medi-Cal work in long-term care. So on many topics you can find there for free. I'll be right with you, the question. Okay. And then on our part, what you can do when you're looking for a facility. So part of it, I know, a lot of times this comes up really last minute. A lot of times you don't have, a couple days, a week to, look around and shop for the ideal facility because your loved one may be in the hospital and you're getting a call at 4 o'clock saying she has to discharge at 6. And that's the unfortunate part about that. But I think even if there's any anticipation that someone may go there, don't wait until you get that call. Start looking in the area. And I just suggest, just like Crissy, go out and look. Look at different times of day and talk to the residents of the facility. So if you're on a marketing tour and you stop to talk to a resident, ask them how they're doing with their care, I think if the marketing person looks kind of leery, like, oh, let's move along, not talk to them, that's a red flag right there. So make conversations. Ask them, how long have you lived here? How do you like the food? What kind of activities do they have for you? Ask the residents, because they're the experts on what's going on in their facility. And when it comes to trying the food, I learned this lesson when I worked in a facility. Their food is always a big issue for everybody, and the quality of food. So when you're going to try the food, if your loved one has a medical condition that requires them to have some type of modified diet, let's say they have to eat pureed food, mechanical soft, there's all these variety of diet levels, eat the food and the texture your loved one's eating. Because when they're complaining to you that the food's awful, you'll know exactly. It may look okay like a steak, but when you puree it, it's not as tasty. Thickened coffee, not as tasty. They made us do that when I worked at a facility. We ate the food at every type of texture. It tells you a lot. So that way you understand a little bit of what they're talking about and complaining about there. So, and also like with public records as well, if you go into a skilled nursing facility, they will have, usually in the lobby or in some kind of public administrative area, they are required to have a binder with their most recent visit in it and complaint visits. So I would grab it, read it, sit there and read the binder, do some research. So, and then with that, here is our contact information that we'll leave up for you if you want to reach us in any way. Our line is monitored 24/7 for Ombudsman. We also both have tables in the exhibit hall. Some of the Ombudsman staff and volunteers are out there, and some volunteers and Crissy's counterpart are at the table. So definitely, I know we don't have a lot of time for questions here, but we can definitely do more there. So I know someone had her hand up there for questions. Can I start with you, ma'am? Oh, CMS. So yeah, Nursing Home Compare. So if you actually just put in like a search engine, Nursing Home Compare, it'll probably be the first thing that pops up for you. Okay, and then her in the black right there, you were next. Yes.
assisted living facilities right now, per regulation, are inspected once every 5 years. There's a bill right now going through the legislature that's trying to make them annual. That hasn't passed yet, but as of right now, once every 5 years, unless there's a complaint. So if you're having problems, complain, and they'll go out and they'll visit. Oh, skilled?
Skilled or annual, and upon complaint. So, and then I think we have time.
It's only, we've got 6 or 7 minutes. For
Okay. Oh, perfect. Okay. Right, ma'am.
I happen to be on the mental health board in the county,
Okay.
and I have learned that for board and cares, some are licensed. Actually, in our county, we only have 70 licensed board and cares for mentally ill, and 600 for unlicensed. That are unlicensed, it's the same thing in the assisted living situation. Are there unlicensed board and cares?
They may be in operation, but they're operating outside of the law. If you are providing care and supervision in any form to a non-family member, you need to have a license with the state.
There's actually a little bit of misconception. You hear about independent living facilities. They'll say, oh, we're a licensed independent living facility. Unless they're licensed by community care licensing as a residential care facility for the elderly, they're operating illegally, and they're just not getting that license. And we don't know how many of those there are, because they're just kind of flying under the radar and operating illegally. So, Nancy?
Yeah, I'd like to comment on what you said about a hospital making a last-minute call to
Yeah.
a family member saying this person can be released today and you got to get out of here. I hope everyone realizes that they're not allowed to do that, and that no one should feel forced to leave a hospital and go to wherever the discharge planner sends them. I'm saying that a hospital cannot give you a last-minute discharge and say you're going to a nursing home and this is where you're going, period. Often without even notifying family. I think everybody needs to know that a hospital needs to give advance warning. They can't simply say you're out of here today and otherwise you'll have to start paying tomorrow. That's against Medicare regulations. It's not legal, it's not lawful. I think the individual has up to, 3 days before they are actually going to start being billed if they're no longer covered by Medicare. So I think everyone needs to know that, because very often patients are shipped off, and too often their families don't even know what's happening.
And to piggyback on that, if you are having trouble, you can find the patient advocate in the hospital, and that's their job, is to help you get the information you need and to be able to stay as long as you're supposed to. So the patient advocate in the hospital is there to help you do that.
And I'd like to ask a clarifying question. Sure. So RCFE, Residential Care Facilities for the Elderly, include both the board and cares with 6 or fewer beds and what we usually call assisted living with more beds.
Yes.
And they're all under the same licensing.
Yes.
And then under a whole different licensing, you've got your independent, and then under a higher level of licensing, you've got your skilled nursing.
Yes. The independents are not licensed.
Oh, independent
Actually,
don't even have the
they're
license.
not regulated in any way. But
Thank you.
It's a very much a misnomer, because you'll go away and they go, oh, we're a licensed independent living. It doesn't exist, but it sounds good. So that's what you'll get told. But if it's independent living, they're not licensed. Nobody's regulating those. Absolutely. There's the Independent Living Association, and they're working to try and get standards set and have people comply with those. So we can, because they are so all over the place and regulated, we're trying to get that information together. So they're doing great work.
Great.
And it is true that if you have independent living next to, that's like kind of this continuing care, it's not a continuing care retirement community, but if you've got an independent living next to an assisted living, the state has jurisdiction over the independent living. So we've read in the public record situations where someone has fallen in independent living, and if this facility is providing both types of care, the state can go in and investigate that fall. So there is some overlap there.
Okay, we have 2 more minutes, and I know this gentleman has been waiting for a question.
Thank you. Just very brief question. Is there a website that complements the nursing home compare for other facilities like assisted living and so forth, with ranking and so forth?
So no, assisted living is not ranked yet. It's hard to do because they don't collect metrics like nursing homes report to CMS. Assisted living facilities do not have to report any of those metrics, so a rating system would be based on not hard data. But what you can do is CARR has the actual compliance histories like CMS does, but it's just the compliance histories online. You can go and read for yourself. And we also have grant funding through the county to provide snapshots, which are going up. We have about 70 facilities right now, and we'll keep doing them, where you can look at an overall picture of how many citations a facility has had, how many complaint visits, just in total. So there's no rating system yet. But yes, ma'am.
How about the placement agencies? Where do I find placement agencies?
You can get on a computer and Google it. You can look in the yellow pages for placement. There's some here at this as exhibitors. Oh, and they're in here. Yeah, this is a great. I can give this to you if you want it when you leave. Where do you find placement agencies? And the answer was in these guides. There's some here that are exhibitors. You can.
Are there
search.
catalogs listing different facilities?
That would be this one as well. This is the most comprehensive, I would say. The UT's Elder Guide is the most comprehensive listing what's available here in San Diego.
And then I think we have time for one more?
Well, tell them about that and then.
Okay, I wanted to make sure to get this out. So we talked about CARR's website and some other resources. This handout is on the back table there, so feel free to take one when you leave, and it has our contact information and some other resources on there as well.
Yeah, one side is caregiver resources, and the other side is elder protection resources. I think they're in 2 piles on the back table, and we also have them up here, so before you leave, you can take those. Okay, and then we had another gentleman after you, so I think we have time for one question.
One more. And then, we both have booths in the resource area, so feel free to talk to anyone there as well, and they're happy to help.
Thank you. Just speaking of the UT and metrics, as you mentioned, Crissy, you have on your site the data on surveys for RCFEs based on community care licensing data. And I'm referencing now the series of articles carried by the Union Tribune that basically said that community care was not doing their job. So if you're garnering data from that site of the enforcement department, how accurate is your data?
It's problematic, I would say, but it's all that's out there, and no one's collecting it to this point. So we're doing what we can with making lemonade out of lemons.
I got you. On the same subject, on the 5-star rating of nursing homes, as a word of caveat, you need to look beyond the metrics on those, because there are some facilities that may show below the staffing requirements, 3.2. They may be up to 4+, and that's because of the type of patient or resident they care for, whether it's trach, subacute, and so forth. So you need to be able to understand those 5 stars and compare apples to apples, because there are facilities that may not have all 5 stars, but are, in fact, have waiting lists because of the specialized nature of the nursing home patient they take. And there's some here in San Diego County that are just wonderful, and yet the metrics aren't at 5 stars, and they have a waiting list worldwide.
And that's why there's no straightforward, when you're shopping, there's just no one way to do it. I mean, it really takes time. That's why we recommend starting the process before it's a crisis situation, because you really do have to do your homework to make sure, to reduce the risk of harm, right, and to make sure you're in a good place.